For many people about to start chemotherapy for mesothelioma, nausea is the side effect they dread the most. The scenario they anticipate is a familiar one: cancer patients laid low by relentless nausea and vomiting, unable to eat, unable to function, and I have to acknowledge that that image comes from a real place. For many years, it was exactly what was happening. But here's what I want you to know today before anything else on the topic. Nausea control has changed profoundly over the past 20 years. Today, with the right combination of medications given at the right times in the right way, most patients receiving chemo for mesothelioma can have their nausea extremely well controlled, and in many cases prevented almost entirely. That's genuinely good news. The thing is, it only works out that way when patients fully understand their anti-nausea plan and follow it to the letter. And that's exactly what today's video is about. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a doctor, and this is not medical advice, but today I want to walk you through the complete toolkit for preventing chemotherapy nausea in mesothelioma. What the medications are, why each one is used, how they work together, and the critical things you need to do at home to make sure that the steps you take to control your nausea are as effective as can be throughout your treatment. So let's start with why mesothelioma chemotherapy causes nausea in the first place, because understanding the mechanism helps explain why the treatment approach looks the way it does. The standard first-line chemotherapy for mesothelioma combines pemetrexed with cisplatin. Cisplatin is what oncologists classify as a highly emetogenic drug, which means it has a high inherent potential to cause nausea and vomiting. Just what you want to hear, right? Now stay with me. Cisplatin's tendency to bring on nausea is due to the fact that it triggers receptors in the gastrointestinal tract and in a region of the brain called the chemoreceptor trigger zone. Essentially, that's the brain's vomiting center. This triggering happens in two distinct phases that require two different aspects to your anti-nausea strategy. Acute nausea begins within a few hours of receiving your infusion and typically peaks within the first 24 hours. Delayed nausea begins 24 to 48 hours after chemotherapy and can persist for several days after that. Delayed nausea is actually harder to control than acute nausea. It catches patients off guard more often, and it's one of the main reasons people feel that their nausea control breaks down. Rather than happening on the treatment day, it comes on in the days that follow. Understanding that delayed nausea is coming and that it needs its own medications and management is foundational to managing it well. For patients receiving cisplatin-based chemotherapy, the American Society of Clinical Oncology and other major organizations recommend a 3-drug antiemetic regimen to start. 3 different medications targeting 3 different mechanisms are given together to prevent nausea from taking hold rather than trying to stop it after it's already started. The first class of drugs is what are called 5-HT3 receptor antagonists. These drugs block a specific serotonin receptor that plays a central role in triggering nausea, both in the gut and in the brain's vomiting center. Common examples include ondansetron, which goes by the brand name Zofran. It's probably the most recognized name in anti-nausea medication, but there are others, including granisetron and palonesetron, brand name Aloxi. Palonesetron is often the preferred choice for cisplatin-based regimens because its longer duration of action makes it particularly effective against both the acute and delayed phases of nausea. The second class of anti-nausea drugs is the NK1 receptor antagonists. These drugs target a completely different pathway, the neurokinin-1 pathway, which is especially involved in delayed nausea and vomiting. Aprepitant, brand name Emend, is the most commonly used drug in this class. It's typically given in a higher dose on the day of chemotherapy, followed by a lower maintenance dose on each of the 2 days following the infusion. A newer combination product called NEPA combines netupridine and palinesitrin into a single capsule, providing both an NK1 and 5-HT3 blockade in one convenient oral dose. The third component of the standard regimen is dexamethasone, which is a corticosteroid, which plays a surprisingly powerful role in preventing nausea, despite being primarily known as an anti-inflammatory. Dexamethasone is a component of almost every chemotherapy antiemetic regimen, particularly for delayed nausea control. Its effectiveness in this role is very well established. Now, I'm going to take a break here to ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, moving on, a fourth medication worth knowing about is olanzapine. The brand name is Zyprexa. It was originally developed as an antipsychotic medication, but since then it's shown remarkable effectiveness as an additional antiemetic agent in patients receiving highly emetogenic chemotherapy. A large clinical trial of 710 adults receiving cisplatin-based chemotherapy found that adding olanzapine to the standard 3-drug regimen improved the rate of complete nausea and vomiting prevention in the delayed phase from 66 to 79%. That's a very meaningful improvement, and ASCO has updated its guidelines to include olanzapine as an option for patients at higher nausea risk. At a lower dose of 5 milligrams, olanzapine appears to provide the antiemetic benefit with fewer sedation side effects than a higher dose, and it's become a common addition at major cancer centers treating patients with highly emetogenic regimens. Now, I want to talk about something that trips up a lot of patients because it's genuinely one of the most common reasons that nausea control breaks down, even when the right medications are prescribed. Many patients take their anti-nausea medications faithfully on the day of chemotherapy, and then they stop. They feel okay that evening, they go home, and they figure they're past the worst of it. Then delayed nausea hits on day 2 or day 3, and they're caught completely off guard without medication on board to control it. Please don't let this happen to you. Your anti-nausea medications should continue for 2 to 4 days after each chemotherapy infusion. Your team is going to give you a specific schedule, and you need to take them up on that schedule, whether you currently feel nauseated or not, because these drugs work by preventing nausea from establishing itself, not by trying to suppress it once it's already taken hold. Much like with pain treatment, treating nausea reactively is a much harder thing to do than preventing it proactively. Unfortunately, no matter how compliant you are, sometimes nausea breaks through. Your care team should provide you with what's called a rescue medication for exactly this situation. That's a shorter-acting anti-nausea drug that you can take on an as-needed basis when breakthrough nausea occurs. Options for this include prochlorperazine, lorazepam, and metoclopramide, which among others. If breakthrough nausea is significant or consistent across a treatment cycle, please tell your team. The regimen can often be adjusted for subsequent cycles. Alongside your medications, practical strategies at home can make a real difference. Small, frequent meals are better tolerated than larger ones, and bland, low-fat, easily digestible foods are kinder to a chemotherapy-sensitized stomach. Staying hydrated is important, but sipping slowly is much more effective than trying to drink large amounts at once. There's genuine, if modest, evidence that ginger in various forms, teas, candies, supplements, they have an antiemetic benefit, and many patients find using it a helpful complement to their pharmaceutical regimen. To review, mesothelioma chemotherapy with cisplatin is highly emetogenic and causes both acute and delayed nausea requiring different management. The three-drug foundation of a 5-HT3 antagonist, an NK1 antagonist, and dexamethasone is the evidence-based standard, with olanzapine being added as an effective fourth option. Taking your medications on schedule for several days after each infusion, not just on your treatment day, is the single most important thing you can do to stay ahead of delayed nausea. You can visit mesothelioma.net for more resources on preparing for mesothelioma chemotherapy and managing side effects throughout your treatment. Or call us at 1-800-692-8608 or use the live chat feature to speak to one of our patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.